In the early 1980s, I became involved in the first multi-city no smoking laws in the United States. This was in Northern Californian areas called Contra Costa, which means the opposite coast across from San Francisco. And it was the first time, there were 18 cities in our county. It was the first time that we tried to make consistent change in more than one place in the United States at once in terms of tobacco policy. As public health prevention director, I brought together the American Cancer Society, American Heart Association, and American Lung Associations of our region, and we said, how can we create policy change? Let's remember that a generation ago, smoking was the norm and completely acceptable, even encouraged. Everyone smoked. Parents and teachers smoked around their children. Movie stars smoked. Politicians smoked. Athletes smoked. Doctors smoked. And cigarette companies even had physician endorsements. There was no such thing as a smoking restriction. Every bar and restaurant had a cigarette vending machine, and smoking was allowed in all public places. When we began our initial efforts to ban smoking, people kept telling me it would be impossible. They said, look, tobacco is sexy. It's in all the movies. The industry is too big to fight. It's embedded in every key institution. And we said, well, that may be, but smoking is killing millions of people, and we're ready to do something about that. We knew that to have real impact, we needed policy change. As we now know, once that policy change took place, we would never go back. In fact, early understanding of the power of policy change is what really worried the tobacco industry. The very next day after we decided on this uniform no smoking law, the very next day, I got a call from someone from an organization I'd never heard of. It's called the Tobacco Institute. Of course, the Tobacco Institute was the lobbying arm of the tobacco industry, and although there was not a stick of tobacco grown in California, they had more than 20 lobbyists working in the state. This guy was the director, and he asked me to have lunch with him in, of course, the most expensive restaurant in our county seat of Martinez. When we sat down and talked, I was very happy to have lunch with him. When we sat down and talked, he immediately asked me what else I was involved in prevention work. He knew a lot about my work and said he'd heard I was doing a very good job, which was nice. I'd only been working in prevention for maybe 6 months. He said I was doing a very good job, and pretty quickly the conversation turned to car seats. At that point, we recognized that if we could give out some free car seats, it could really make safety more doable for some low-income communities, for some people in low-income communities. And so he immediately said to me, how many car seats do you want? I'd really been trying to come up with money for 40 car seats. A friend of mine had said, a colleague, whatever you do when you talk to a lobbyist, think big, add a zero. So the 40 car seats I wanted, I immediately thought in my mind 400, but I was very nervous. I added a zero. And so I blurted out that I was looking for 4,000 car seats. And he didn't blink. 4,000 car seats. He didn't blink because he was very concerned about the tobacco policy work. Now that's what was really, really interesting, because he was very, very comfortable with tobacco education. He was very comfortable with tobacco cessation, but he just found that policy work. He said, why don't I stop doing it? It's dirty, it's distasteful. And in fact, by the end of the lunch, he had offered to triple my salary if I wanted to do prevention work for the Tobacco Institute, of course, without doing policy work. We ended up passing no smoking laws in those 18 cities, and it had an enormous effect. Because the Tobacco Institute, the lobbyists could be very powerful on a national level, they could be very powerful on a state level, but there was no way that they could have clout in every community across our county, or better yet, across the United States. Now, our policy wasn't a very ambitious one. We were talking about 40% no smoking in a restaurant, 60% smoking. What could that do? Would that really end lung cancer or heart disease or emphysema? Of course not. But it did, because I describe this as kind of the snowball of norms change. And it keeps rolling down the hill, and pretty quickly we had a bidding war. And the next town over said 40%, why don't we make it 50%? And then it was 80%, and then it was no smoking in restaurants. And then the next part I was involved in was no smoking on airplanes. Remember when airplanes used to smell completely of the smoke as you walked to the back of the plane? No smoking on beaches. And now in California, the rates have dropped dramatically. We've saved billions of dollars, but more importantly, we've saved lives. We've gone pretty much to half the number of smokers that there were when we started in 1984. Now, the head of Tobacco Institute came back to me 2 weeks later. He brought these books. These were books about quitting smoking, and they were books about why young people shouldn't smoke in the first place. And do you know who the author was supposed to be of these books? Written in gold letters on the front, it was me. So they were prepared to buy the car seats, to triple my salary, to pay for all these books, of course, because it was nothing compared to what they lost and what we've gained through a focus on local policy. When I look back, people say the tobacco campaign was an easy victory, as was the movement to use car seats. However, during every campaign I've been involved in, no matter how important what we were trying to accomplish could be, people would tell me that changing what's accepted and normal is impossible. It didn't matter how devastating its impact might be. Now people say it's impossible when we talk about making sure we have places to play in our communities, or when we talk about changing food marketing, or subsidizing sustainable agriculture to grow healthy food instead of raw materials for junk food. Even when we talk about making our communities safe, changing the conditions that encourage violence in our boys and men, or not exploiting children or women, the response we hear is that's just how it is. It's too complex to change the norm. But we can change these norms and advance well-being in our communities. It's true, changing norms starts slowly. Just like a snowball, once it starts rolling, it grows ever faster, ever easier. We change norms through policy, and there's no question if we work together with patience, energy, and commitment, we are going to succeed. We can learn from the success of those first no smoking laws and how worrisome policy change was to the tobacco executive. His preference, of course, was that we work on prevention but leave policy out. In fact, it's exactly the opposite. Policy is where we're going to stay. Policy is where we're going to flourish. Policy is one of the places where we're going to win.